It's a pleasure to be here, and I'm hoping I'll be able to show you some ideas. Really, if this works out well, at the end, you may feel, look, this is what we do as general practitioners and good physicians. We do all of this, and I'm going to suggest that's great. Plus, if you do a little bit extra, you can get even more results. So that's really where I'm coming from. I've been involved in integrative medicine for 30 years and on various government committees and WHO committees, etc. But there is still this sense of what is integrative medicine. As you see there, the left-hand path is our ordinary, the beaten path. And if people start wandering off on another path, are they sensible? Are they mad? What are they up to? So I'm hoping I'll take you down that path a little way. So there are confusing terms which makes it more difficult. So one I prefer, and it's more of an international one, is integrative medicine. But there are quite a lot of other ones. A commonly known one is complementary and alternative medicine. In Australia, they simply say complementary medicine. In the WHO, they throw in the traditional component because that's very important to a lot of the other countries in the world. And finally, in America, they use the word functional medicine. There are a whole load of definitions, and I'm not going to go into too many, but this is one of the earlier ones in the BMJ, and it's really just saying it's seeing the patient as a whole with minds and spirits as part of how we view them. There was a later one on the next year, and it developed it a bit further. It says, look, it's a comprehensive process looking at the wellness and healing of the whole person, not just the suppression of somatic disease. There's an organization that I'm part of called the Australasian Integrative Medicine Association for doctors in Australia and New Zealand. We have quite a large membership and meetings and conferences, etc. But it has its own definition, which is a kind of amalgamation of what I've just been talking about. So looking at the combining of the best of conventional Western medicine with evidence-based complementary medicine and therapies. Again, that focus of the relationship with the patient at the center, which is part of normal general practice now. And also bringing in all the different components of what that person is and their well-being. In America, they've got a similar definition, but I kind of like this. They talk more about the genetics and the biochemistry and how to leverage the data to get good outcomes. So very much a more American approach. A colleague of mine, Professor Mark Cohen in Australia, has said, well, look, that's all very good, nice having definitions, etc., but are they really important? He's a professor of integrative medicine, and he has said quite rightly, I think, that ultimately we're about trying to help human suffering. And it's not really about what's orthodox or unorthodox. It's about how we work together as a multidisciplinary team of people, and how we actually bring that together in terms of the patient and the wider community. So I think he's onto a good thing there. If we go a little bit further, the WHO have some pretty interesting ideas, but I particularly like this one from Albert Einstein. He says, a human being is part of the whole called by us universe, a part limited in time and space. We express ourselves, our thoughts and feelings as something separated from the rest, a kind of optical illusion of consciousness. Our task must surely be to free ourselves from this prison by widening our circle of compassion to embrace all living creatures and the whole of nature and its beauty. So I guess at one level, medicine is about trying to get to that place. So what about integrative medicine? Is it happening? What's going on out there? In various countries, they've looked at some of the statistics. In New Zealand, they're a little bit old, some of these, but at least back in 2004, 50%, well, a quarter of the population would use a CAM practitioner within the previous year. And they looked at one group of GPs in the North Island and found that 92% of them would refer to CAM practitioners. So there's a lot of awareness and a lot of it happening in the population. If you look at its use in New Zealand and wonder why people are doing it, well, a variety of things. First of all, who's doing it? Massage therapy, chiropractors, and so on. A great number of practitioners out there offering various forms of CAM and offering them for various conditions, mainly musculoskeletal, but various other things as well. What are the factors influencing IM use? And this is a graph which compares the Western world with the Asian populations, because in the East, they have often a different approach to it. But largely from the patient's point of view, it's about perceived benefit and also quite often dissatisfaction with the mode of medicine there. So very much how the patient sees it and why they go for it. Of course, there's a huge market in these areas, and we know that over the next decade or two, it's a very major, big money process at a global level. Going back here to an assessment that was done in New Zealand back in 2004, and it was a committee put forward by the then Minister of Health, Jenny Shipley, to go through the idea of how we could perhaps bring these ideas into the modern medicine arena. And I was a medical advisor on this committee. And it came up with some wonderful ideas at the end of 3 years, suggesting there should be public funding for a lot of the modalities. It should be part of the medical curriculum. We need to find out how it fits in best, and even district health boards should be involved. And in a sense, that seemed wonderful, but of course, what happens after 3 or 4 years of a government? The government changed and the report was binned. So it's just to say ideas have been there about how to incorporate this form of wider medical care, but so far, nothing has happened at a government level. What about the politics? Well, the Health and Disability Commission says, yep, providing you look at all the usual things we should do for any way of treating a person, it's fine to do these sorts of practices. The Medical Council has a whole document. It's a statement put out 3 years ago. And I'll just highlight a couple of bits of that so that you get a flavor of it. One is that CAM can be accepted when it has minimal risks and may have benefits. The council doesn't oppose its use. That's number one. Secondly, which is probably important to all doctors, that is, if a patient expresses interest in it, you should respond in an unbiased professional manner, irrespective of your views on it. And they go on further and say that you should help them evaluate the likely benefits, make it clear your limits of knowledge, be aware of their own belief system and how that should influence their choices, and help them make basically an informed choice without getting your own ideas too much in the way. If a doctor practices some form of integrative medicine, they also have some very clear boundaries, and it comes down, basically, you should practice a good standard of medicine, which we obviously all will be doing, hopefully. At the WHO level, they very much promote it around the world because partly it's a more cost-effective way of treating in some of the poorer countries. And they make a point that, unfortunately, most research in medicine goes into the high-cost areas of medicine and into the pharmacology, with very little going into the traditional forms. And hence the level of knowledge and proof is a lot smaller. I put this slide in saying, okay, what are integrative medicine doctors? They're basically the same as every other good doctor, looking at a collaborative, person-centered approach and so on. And all the things you'd expect yourself to do in a good general practice. What they're not, however, is they're not unscientific, because the whole process of integrative medicine is we should try and use as much science as we can. They're not normally isolated. They're part of a general collaborative approach. And in terms of dangers or risks, this is often brought up, but this is the adverse drug reporting. And if you go down the years on the left, that's the latest one I could find, but the normal drug reactions are in the 16 to 17,000, where the complementary medicines are down around 1 to 2% of that. So overall, much safer. I quite like this graph. It's more for fun. That this is one done in the UK, and what they're doing here, these big globes, they're looking at deaths per million population from whatever cause. So the one here, the mauvish one, is if you're a soldier in Afghanistan or Iraq war, you had a pretty high mortality rate. However, medical injuries in hospital are about the same, and pharmaceutical drug reactions are just behind that. And you can go all the way down those series of possibilities until you get to things like lightnings. And then finally, in the bottom left-hand side, which is at a corresponding size that you can't see it, and hence it's a dotted circle, you have food supplements and herbal supplements, etc. And you've got a similar likelihood of being hit by lightning as to have a death from any of those. So it just puts things in a bit of perspective. And I'm putting here, it's controversial maybe, but the risks of not practicing integrated medicine. Well, I'm using Australian figures because they've got more up-to-date ones, but as 70% of their population uses complementary medicine, we're kind of getting out of touch if we're not aware of what's going on and how we can collaborate. A lot of Australian adults go to their, don't talk about this to their own doctor, they will to an integrative doctor, and often they feel sidelined by their own doctors and aware that specialists don't tend to feel confident about discussing it at all. And just putting that at the end is communication failure is the leading cause of patient harm according to their Joint Commission. So it's very important that we do talk about these things. We're very open about them, and the patients are made to feel at ease and able to talk about them. Not going to go into this too much, but I'm just saying, okay, we know what the core metrics of healthcare are. They're about effectiveness, efficiency, and good health outcomes in a safe manner, and hopefully cost effective. So I thought, well, okay, let's look at that. In a real world trial, it's called the IMPACT trial, they looked at the use of integrative medicine in a primary care situation, looking at various components that were used, and they found, as might be expected, that they got a better outcome in terms of the overall symptoms and well-being. Again, it wasn't a controlled trial. However, there have been some trials looking at how cost-effective an integrative medicine approach may be. And they found overall that IMGPs were less costly. This is one particular study done in the UK, and this is a much larger one, which was a large number of evaluations over 10 years. And they found that overall, most studies tended to show about a 30% cost saving. Going on in the USA, medical schools teach integrative medicine to some degree, and at least half of them do that, including the Ivy League medical schools. And it can be part of their core competency in medicine, in general practice, or just the degree. In Australia, there are several universities that do offer integrative medicine courses, but I'm afraid in New Zealand there aren't. Just looking at those topics that the USA courses have in their medical schools, a raft of different things, but just giving you a flavor of what is taught as part of the normal curriculum. And also there is a whole organization of research institutes looking at the evidence for these things, including really the top universities in the States. So what about proof? I particularly like Larson, I don't know if others do. I'm sort of going to turn the microscope around a wee bit and say, okay, in our ordinary evidence base for medicine, how good is it? So this is a study in the Internal Medical Journal 2 years ago. What did it say? Well, it wasn't that complementary to ordinary medicine. What it said is that despite the evidence-based medicine movement, contemporary medicine appears to remain largely evidence-poor and not evidence-based. And you think, well, that's one study. Here is a Cochrane review. And the Cochrane review was out last year. And they looked at the evidence for medical interventions overall. And comparing that year with 7 years before, they found that the high level of evidence for medical interventions was only around 10%, moderate 37%, low 31%, and very low 22%. So we've got to be careful what yardstick we use when we start talking about one form of medicine versus another. And just to be a bit more controversial, we tend to use the randomized controlled trial as the gold standard, and it certainly remains that. But I was interested in this study done again by the Cochrane database, saying that on average, there's little evidence for significant effect differences between observational studies and RCTs, which I found quite remarkable, but that's what the Cochrane review said. Going on to evidence-based generally in general practice, there are three main parts according to Sackett's original way of looking at it, and the external evidence is only one component of that triangle. The patient choice is a very important part, and internal evidence is what we make of it, what our clinical judgment is, what our experience is. And I think in general practice in particular, those components fit together very nicely because we're having to sort out, often on the hoof, how best to bring everything together. This is a nice model of disease that Professor Mark Cohen again has put forward. And what he's saying here is when you go from disease at the bottom to health at the top, there are levels. There's ill health and there's average health. But he's also saying, really, we should think about enhanced health, better well-being, and theoretically perfect health, whatever that is. And what he's saying here is that when you get into more and more disease and ill health, your flexibility of response is not very large. But as you get further up that process, you have increased flexibility of how you can deal with it. And most of modern medicine is about getting us from ill health into average health, whereas integrative medicine is trying to get us further on. Are you trying to get a hold of me there, Chappie? I can see your picture. That's okay, just checking. So in a sense, integrative medicine is saying, yes, we do Western medicine, and we try and push it even further into enhanced health medicine. So the take-home message from my point of view, the whole idea of integrative medicine is to bring in all the different aspects of how a person functions with the aim of using the most appropriate, safe, and evidence-based treatments that we can find. And this is particularly useful for those complex chronic problems that really modern medicine has great difficulty dealing with to any successful extent. And to say, is there anything out there that can help me move along this pathway? Well, two that I would mention in terms of nutrition and environmental medicine, one called ACNAM, which is the Australasian College of Nutritional and Environmental Medicine, that's their web-based. This is the American one, Institute of Functional Medicine. And finally, as a general overview and an umbrella organization, AIMA, the Australasian Integrative Medicine Association. So they're my plugs at the end. Thank you very much.